Hello, my presentation topic is on HIV and the role of physical therapy and current research in HIV. Human immunodeficiency virus has been around for 30 years and in that time has moved from being a terminal disease to a progressive, chronic and episodic condition affecting multi-systems. Working in the adult community service, I provide physical therapy for service users with long-term conditions, which includes HIV. Now that people are surviving longer with HIV, different approaches by physical therapists are required. This presentation will consider the impact of the disease and methods of management, including how physical therapists should educate and be educated about the disease and its associated disability. Objectives are to describe the basic HIV disease process and impact of pharmacologic agents on HIV, explain the basic epidemiology profile of HIV and identify HIV disease impact on the multi-system involvement, and be able to incorporate PT interventions for common HIV-related impairments and be able to evaluate the typical PT diagnosis within the larger context of HIV disease. To define the challenges and barriers of working in the field of HIV and the current research and innovations within the field of HIV, and finally to apply theory to a real-life case study. Please pause the presentation and take this pre-test. Also, please look at the links on the right-hand side of this slide. Human immunodeficiency virus is a retrovirus which attacks T cells or the CD4 cells. HIV binds to and enters CD4 cells, makes copies of itself, and there's a gradual decline of the CD4 cells and immune system, allowing the life-threatening opportunistic illnesses to thrive. Untreated, HIV progresses to AIDS, which is acquired immunodeficiency syndrome. There are over 1 million adults and adolescents living with HIV. However, the take-home message of this slide is that there are about 15% that are unaware of their diagnosis. In the UK, there are over 100,000 people living with HIV, and of these, a quarter are unaware of their diagnosis, so therefore are not treated, and at risk of the opportunistic infections which leads to AIDS-defined illnesses. 50% are diagnosed late, and of these 50%, the CD4 cell count is less than 200. The high-risk communities and groups include the economically disadvantaged urban areas and also the men having sex with men, SMM community, and the African Black origin community. There is a geriatric population of 55 and older, and these make up 26% of all HIV infections in the US. Stage 1 is considered the acute HIV infection stage, weeks 2 to 4 post-infection. Massive inflammatory responses occur to the initial viral exposure. The individual develops severe flu-like symptoms with increased lymph nodes, diarrhea, weight loss, fever, cough, and shortness of breath. Later infection, the person may be symptom-free for as long as 8 to 9 years, but the virus continues to multiply and destroy immune cells, and the person may begin to develop chronic signs and/or acute mild infections. Stage 3 is known as the chronic HIV infection stage. HIV reproduces at low levels. People may be asymptomatic but still be able to transmit. Without treatment, the usual progresses to AIDS within a 10-year period. The final stage is that of AIDS, and there is a life expectancy of 2 to 3 years. In the UK, HIV medication is available for free under the healthcare system. Antiretroviral therapy is recommended for all individuals with HIV regardless of the CD4 count to reduce morbidity and mortality associated with HIV infection. People on the antiretroviral therapy take a combination of HIV medications known as HIV regimen. This is taken as one pill every day, and it's comprised of medication for at least 2 different drug classes. Antiretroviral therapy cannot cure HIV, but it will help people with HIV live longer, healthier lives. Physical therapists need to know which antiretroviral therapies the patient is taking, as most of the side effects are manageable but can be quite serious. The benefits of the medications far outweigh the risks of the side effects. The progression of illness can have an effect on multi-system involvement, and this slide just shows all of the systems that can be affected, and so please pause the slide and have a look at the multi-systems that may be involved. The main impairments that may result from the disease include pain, joint pain, neuropathic or abdominal pain, weakness and coordination impairments, fatigue, anemia due to malabsorption, which could be the side effects of medication, cognitive and mental health impairments, sensory loss, some cardiac impairments due to pericarditis, and respiratory impairments. With highly effective antiretroviral therapy, people with HIV are living longer. The physical therapy focus should be how are we dealing with the common comorbidities that people with HIV have, both in terms of medical and psychosocial issues. This is a case study of a 42-year-old male who has HIV for the past 4 years. Please take a moment to study his history. Here are the impairments that were identified in our case study. This list is not much dissimilar to the list of impairments that we had in a few slides prior to this one. It is very important to signpost and refer onwards to other healthcare professionals who are also involved in the collaborative approach for a person with HIV. In rehabilitation, the person living with HIV is a central part of the process. Rehabilitation is most effective when it's part of an MDT approach. Establishing short and long-term goals, both SMART, so specific, measurable, achievable, realistic, and timed. Monitoring and evaluating interventions and recording progress. Signposting and referring to other services and agencies are also important, as is discharge planning and coordination of the services provided. In 2006, Philippas et al. Examined the effects of supervised aerobic and resistive exercises twice weekly in men living with HIV over a 6-month period. It was shown to improve cardiovascular strength, weight, and psychological status and neurocognitive function. Also, exercise can provide several benefits for patients suffering with HIV. This included pain relief, reduction in muscle atrophy, regulation of bowels, enhanced immune function, improving cardiovascular function, pulmonary function, and endurance. And exercise also helped prevent pneumonia and other respiratory infections. Exercise also helped to reduce anxiety and improve mood. These were some of the treatment interventions that were implemented in our case study to deal with the impairments that were identified initially, and most of the interventions would focus on muscle strength, endurance, balance, pain relief, gait and balance re-education, and social integration, collaborating with our other healthcare professionals on the team. The focus on research is adherence, and which seems to be the main barrier because of the nature of the disease. It is episodic and fluctuating, and adherence seems to be the biggest barrier. People with HIV do still come across stigma, prejudice, and discrimination, and this often can be the worst part of living with HIV. We have the obligation to educate our colleagues, friends, and provide education on HIV in mainstream fields of education, and align our services to the disease burden. In summary, there has been vast improvements in pharmacology in patients with HIV, and now this disease is considered to be a chronic illness with complex effects on the multi-system. Main focus is that of rehabilitation and preventative interventions with individualized patient-centered rehabilitation incorporating an MDT approach. So HIV is not much different from many other chronic long-term illnesses that we see.